Good
We're
good
live.
evening, good afternoon, everybody. Good morning for some as well. So welcome to the to our session with Dr. Chris Prue, and we will wait for just a minute or so to get everybody to arrive, and then we will get started.
Do.
Chris, what numbers do you see?
9, 8,
Okay,
9.
okay, we'll hold tight for just a little longer.
Uh, uh, uh.
Give it a minute. We'll let some other people trickle in, and then we'll get started. Okay, let's go ahead and get the ball rolling. So again, good evening, good afternoon, good morning, depending on where you live in this world. Thank you for joining us for another fantastic webinar by our very own Dr. Chris Prue. Today's topic: utilizing dynamic movement assessments with key pathologies. Today we're focusing on running analysis and its effect on increased running speed. So really intriguing topic. Looking forward to this session. Again, thank you for your time. And with that, let's turn it over to the ever infamous Dr. Chris. Thanks, Chris.
Thank you, Brandon. Well, Happy New Year. So I know we tend to get a lot of repeat people, coming back to this, and I know people will filter in and out. And probably for the first one, a lot of the folks will be looking at the recording. So again, happy New Year, and thanks for tuning back in. So as Brandon said, and I don't know how overexciting the topic might be, but like I sort of have this agenda to figure out, different ways to, I think, sort of help people look at the influence of testing. And those of you that have seen me do this before know that, that's a big part of my background. And so there's really two main points to this. So I'll start sharing my screen as I continue to talk. But so the two main points are covering the running analysis. So those of you that
Chris,
may or
for the newcomers, if I
yep.
would just be able to add that for the newcomers, you can use the questions or the chat tab at the bottom right side of the screen to ask your questions. And then at the end of this session, I'll be reading the questions and Dr. Prue will be answering them. And we apologize for you because this session was scheduled last week and then we had to postpone. And luckily, Dr. Prue is feeling better today, so he's doing it. Back to you, Chris.
Yes, the infamous winter flus. So just to reiterate that fact so this is product specific, although obviously the biomechanics of running or walking or whatever the topic of discussion may be is certainly going to be universal, and the information can be utilized in other ways. But so this is really kind of dedicated towards people to understand how to utilize the analysis as a result of taking an acquisition through the system. So that's the first goal. The second goal is I want to start to plant the seed, so to speak, of a thought, not a revolution, but I think to reiterate some of the things that most of us clinicians do, which is really sort of testing and retesting, and to create sort of this added stimulus. And that's the reason for testing at these two different levels of intensity. And it brings me back to this story of I had a patient come see me. He was a professional American football player who turned professional strongman competitor. So very, very strong and powerful, very, very large person in his mid 30s. And he was, as he said, experiencing low back pain. And so I went through, the typical evaluation, and it was very challenging, to find anything really wrong. Like, it was very difficult to reproduce his symptomatology, right? Which is what we try to do, as clinicians to determine, what structures are involved and lead us down to some level of a diagnosis, if not, the causative factors associated with the dysfunction. And it really couldn't come up with anything other than the fact that he showed up with pain. And the thing is too, that a lot of people, pain is certainly an indicator that something is wrong, but it's often not really a limitation to a lot of people. And so as I continued to investigate, and he said, well, it really doesn't bother me much until during competition, when you have to lift up the very heavy stones to put them on top of a platform. And he doesn't experience the problem till he's at about 130 kilograms to lift up that stone, which for most normal people, they never, push their body to that capacity. So similarly on our level here, so as using locomotion analysis, it allows us to evaluate the body as a system whole. And so, yes, I know a lot of people think of using walking or running or jumping to evaluate a very specific performance outcome, like you're dealing with just a runner. But in fact, because it incorporates so many different components of the human body system and how they perform and interact together, it actually makes for a really, really good tool. So if you've heard me speak about walking, we talk about that a lot. So let me start with that too, is from the running perspective, I always take a runner and I have them walk first. I do a walking analysis first because that helps to give a baseline. Because if you know anything about analyzing running, the normative data on running is very small, right? It changes relative to speed. It's very different depending on the height. There are some obvious biomechanical implications to movement and how the body's supposed to function in certain sequences, but from the performance perspective, it can be very, very challenging, which is also why when we look at using interventions to prevent running injuries, they're very difficult. We don't have a lot of good data. The biggest data or the biggest statistical prediction that we have that someone will be injured in running is a previous injury. So that only works if they've been injured the first time, right? But if we do have that, this is where this kind of comes back in. So I evaluate runners, not just runners, but people that are active. So running is a component of most every sport. And so I don't think about it just as runners. And that's why sometimes I'll have people run short stints at higher speeds and different challenges. So the first thing we're just going to go over is really how the system works and the analysis and how to read the system. So after you've acquired an acquisition, so you've collected the data, and then, what do we do with the data? So some of the basic things are looking at speed, which is the velocity. And from that, I will also input some of the notes, what are their pains? They're probably not using walking aids while running, but it could be possible if you're testing maybe some sort of para-Olympian or someone that has a prosthetic or something like that. But if they do have orthotics or inserts in their shoes, then I certainly would make note of that. I also make note of the shoes, because one of the things that we do for people is we tell them, bring in your shoes, bring in your different shoe wear that you typically are using for your activity and your competition, and we can assess that. So oftentimes we'll do it with a treadmill. I have access to fields and tracks, so I can also test people on a track. I can also test people in the gym. That's the beauty of having some equipment that is going to be very portable, so you get to test their environment. So I literally will test people that have shoes. And if you've ever done this, or are looking for outreach programs, go to running stores or go to running events. And it's a great way to show people what they look like while wearing a certain pair of shoes. I've worked with a lot of especially competitive runners, and I have some great stories of what people think is happening, and then we get to show them what is happening. I think the biggest claim to fame is I had one young cross country runner, 5 kilometer specialist, and he did not want to change his shoes. He did not want to change his inserts. He had a 27% difference in symmetry and contact phase, and he couldn't understand why he wasn't running. It was almost as obvious that you could actually see it, but when someone has a really fast pace like that, it's very difficult to even pick something up like that. And we've done it with sprinting too, almost impossible to do that. So you actually get to see their speed. Now, I asked for two things, at least initially. I look for, one is, what speed can you run at comfortably, potentially without any symptomatology. Then we look at speeds that actually someone might experience the symptomatology, or it's also distances. So we can collect up to 2 hours of continuous data. I wouldn't normally do that. So the average, time. So that's why I like to use speed, because speed is a good stress overload, right? To sort of bring about some of this dysfunctional movement patterns that we can evaluate, unless you're specializing in running and you need to get that detailed. Yeah, you might have to have someone go out and run an entire 5K or 10 kilometers, or potentially even a marathon if you've got a world-class marathon that can run in less than 2 hours, right? So the cadence here, so one of the things that the system does, and that's part of the artificial intelligence platform, is in some metrics, it can post it against normative data. So what we do have is, when you input the data of the patient, you input their demographics, right? Their age, gender, height, weight, shoe size, and things like that. So we do know that there should be a certain cadence based on someone's speed and their demographics. And so what we see here is this person has, on the low end of what's considered to be the normal steps per minute. And that's pretty common. Sometimes you'll see this in red in trained people. And the reason for that is, when we look at stride length, right? So you can improve stride length, and that's going to improve speed, right? So if you have a longer stride over the same period of time, you're going to cover more ground. Or you can increase the cadence while maintaining the same speed, and that's also going to make, or while maintaining the same step or stride length, that's also going to make them run faster. So trained people usually have worked at that. And if they are a runner and they're more efficient, they tend to be on the low end of that cadence relative to almost any speed. So that's pretty normal. But when we're working with people and we're trying to get back up to that, knowing that information can be relatively important. Here you see the graphical representation of the speed and the cadence. And so you can look at that very quickly. If you notice anything really strange, you can actually put your cursor over that particular point and get that specific data. So this actually gives you a 15-second aggregate or so of that data. So it's not that one moment in time, it's actually over 15 seconds. But the longer you do this, so it's interesting, over an entire 5 kilometers, I can literally look at every 15 seconds, right? So we can pick out some of these moments in time. And so if someone tells me that at approximately 10 minutes into their training or into their run, they start to experience knee pain or foot pain, we can actually look that up, and we can see some of the changes that occurred as a result of that. The symmetry, that's another characteristic or a biomarker that we can actually establish. Now, it looks a little bit different if you're familiar with the walking analysis. The walking analysis, once we start to approach a 12% asymmetry, right, or an 88% symmetry, it starts to show that there's some abnormalities there. When it comes to running, that's actually shortened up. So even some of the studies that we've done in various movement patterns, we found that seems to be somewhere, normal is going to be about 2 to 8%. And more than that, means that there's potentially a problem. Less than that means there was a problem, and they still might have that problem. But we see that typically that shrinks down sometimes in very chronic cases where people have had to overcome that. And again, especially in some of our para-Olympians that maybe had, have cerebral palsy, and they worked really hard to overcome that limitation and improve their performance as much as they can. They tend to have that lower variance when it comes to a lot of their overall movement patterns. We see here that we actually get a strike angle and their strike force. So we don't have a standard on either one of those per se, but what we can gather from that is looking at symmetry between the right and the left foot. And we can look at that in terms of changes as someone is going through either a rehabilitation process or we're training for performance. So we see a negative angle here. That's the angle actually between the base of the foot and the ground surface, right? So it's not dorsiflexion or plantar flexion. That's going to represent the angle of the surface. They're related, right? If you also establish the lower shank position, you could actually measure that, and you can shoot video, especially if they're on a treadmill at the same time, which we also do have. But for this purpose, it actually helps us to identify whether or not they're a rear foot or a midfoot striker, or potentially even a toe striker, right? So this is identifying that this particular person is a rear foot striker. Now, sometimes if you're training or working with these athletes and you want to have them change their pattern, if you have the midfoot strike, what you typically should see is you're going to see this angle actually change. It will reduce closer to 0. It might even be 0. It could even be a +1 or a +2. And in comparison to the same speed, a couple things that you'll see a reduction in their strike force, because that's very typical in midfoot striking. And that's why a lot of people like to use a midfoot strike, because it reduces contact force. And there is some implications that can actually lead to a reduction in potential injuries. There's a sacrifice, though. One of those sacrifices is you'll see a shorter stride length and potentially a higher cadence to compensate for that. So it does have an influence on efficiency. I don't want to get into, training runners, but that's the reason why that's a pretty good metric. So we go down to the running profile, and you actually see that we do have the stride length, and this is where you see the stance and the swing phase. You're not going to see the breakdown in the profile here like we do in the walking, and the reason is because there's not a normative data. Even the same person, as we see, runs faster, what's going to happen is the stance phase is going to decrease. The swing phase is going to increase in percentage, and we're also going to see an increase in the double float. As they're running faster, they're spending less time in contact with the ground because they're covering more distance with each step and stride. Okay. So that's a metric that one of the things that we'll look at is either two different speeds, or we're going to certainly compare the right and the left. And they should be somewhat similar. And I'm going to bring this up when I show you the next running profile. Is when we start to see asymmetries in contact phase, for example, right, which is this one up here, right? So that's +3%. They're spending 3% longer time in contact with the ground on that right foot. Here's what's interesting. Even though they're spending more time, because I just told you that when you run faster, you spend less time in contact with the ground and longer swing phase, that they have a longer stride length, even though they're spending a little bit more time in ground contact. And you should question and say, why is that so? Well, they're turning over that stride faster on the left side. And that's a very common compensatory mechanism, because the body neurologically wants to be symmetrical. And so sometimes we'll start to see this, and when we get to the next one, we'll see it as well. But sometimes you'll start to see this, and even though they're not experiencing pain, it could be an indication that maybe they're going to experience that, but least of which it's going to potentially have an influence on their performance. So if they are trying to train for performance, that can matter. And then there are some other reasons too. And it could be because the right foot here is actually normal. And it's simply because they're not spending as much time. They're actually spending less time, if that makes sense. And that's why I look at the walking profile, because the walking profile does in fact tell us is if there is a degree of asymmetry, it tells us if one side is normal, and it tells us if the other side is either too much or too little, right? That's the advantage of going back and doing a walk. And people will argue that the biomechanics are different. They are, but the neuromechanics, there's a lot of similarities there. And so there's a good reason to potentially look at that. You also get some of the normative data that we see here in this pronation and supination that you don't get from running. So let's look at that. And here is the contact. So this is on heel strike, and this person is a heel strike. So their foot in is a heel strike pattern. And we see that the inversion of the rear foot is at -15 degrees and it's at -10. So we're actually seeing a very dramatic difference between the right and the left on the landing. We see a slight difference in the transition. So as the foot comes into a foot flat position, they equalize to some extent. And then when they go and prepare for propulsion, right? So late stance phase, preparing for early swing phase, we see that this foot, that left foot, seems to divert back to that position that it did during heel strike, when maybe that's not the best position, right? So here's the pattern that we see. And there's a couple things to look at here. So this middle line right here is the average or the mean of all of the contact points for each step. And this is the same on this side. So the way that you read this is called the pronosupination graph. And so put your cursor over the first point, and that's on landing. We call it landing instead of heel strike because some people run and their landing is actually going to be a midfoot. And then the transition is when they go into complete foot flat position before they start to get ready to lift off the back of their heel to get ready for propulsion. So we break that down into these two events. Okay. A negative angle means that there's going to be slight heel inversion, or that's the direction of heel inversion. If it became positive, it would be eversion or pointing out. And so this is the trajectory. Remember, like in the walking pattern, this is the trajectory of a foot in a shoe, which is going to be a little bit different than a foot not in a shoe. So we're looking at the foot as a complete block model as a foot functions in a shoe. So your normal trajectory, if you look at this right foot here, there's going to be slight inversion. So they're heel striking. So they strike with their foot pattern in a slightly heel inverted and likely pronated at that forefoot. They reduce that a little bit. Okay. And then as they're transitioning, remember that we transition off to that first and second ray on the foot. So we should see a little bit more neutrality, right? Going into a less negative angle. And again, sometimes it might even go positive depending on the person. And it could be normal if it's the same from side to side, right? So this person does stay in a slight negative angle. I don't see that as a bad thing. This could be also the potential shoes that they're wearing. So in some of these cases, especially if you do not have a walking analysis, do this comparison between the right and the left. And you don't need to be a specialist to see that they're wrong. So if we look at this left right here, so you need to figure out which one is wrong. And I'm telling you right now that the right is following a fairly normal trajectory and the left, right, is actually not. So what that means is on that toe off, if we had a gait line on this, it would probably show that they are going into propulsion phase off of the third or fourth ray on that foot, maybe second ray, but in any event, it's not a good position. Now, here's what that can potentially do is it might shorten that overall time. And we can calculate this, and we see in percentage wise, we see that this person does spend more time in that propulsion phase, right? So it means that they're transitioning over and they're not getting really good plantar flexion or preparing themselves into that swing phase. So even at this speed that this person considers to be fairly normal, we're already seeing some limitations if this is their normal speed. So then let's go up and we can get into this details view. So what's different about the details view is it just puts all the information down instead of looking at the mean of all of the running data. We can actually click on a point. So if we click on a point in time, remember that's going to be a 15-second aggregate, and we can see what kind of information we get with their speed and their cadence. We can look at their attack angles. And so it gives us a comparison between the right and the left at any given moment in time. So this is interesting because, again, if you want to evaluate what's going on in the first kilometer, then some point in time in the second kilometer, the third, fourth, and fifth, if you have someone actually run that far, then you're able to do that, right? So we can check on and we can click another point and we see that they start running a little bit faster. We can compare those 2 points. We can leave it as is, whatever you would like to do. But what we see is our ability to actually is actually to take the information that we saw as the average or mean data, and now we get to look at a much smaller aggregate of that information. So again, here's something of particular interest. There seems to be a foot problem here, if not a lower limb problem of some sort, is what we would take this into consideration because of what's going on here in the foot. The strike angulation and the propulsion angulation are much, much different than what we see in the right foot. So this is consistent in that left foot. And I'm going to go back for a second here because I skipped over something that I really like to talk about. So what we have here is these thin lines on either side. I like seeing this because, like I said, I like to look at the variability. And so these lines here are the standard deviation. Okay. It's written as min and max, but it's actually, it is a standard deviation. So we see a much higher standard deviation on the other side. This standard deviation is actually normal. This one's a little bit wide. So one of the things that we associate with increases or abnormalities in variability, if you're familiar with the gait variability index, for example, that's aggregating different metrics in a walking profile and looking at the variability to establish an overall score. Well, this is just sort of one of those. And what happens when we see an increase in variability? It usually means that there's some sort of lack of appropriate motor control, their inability to repeat that same position over and over again within what's considered to be the normal, right? Which was about 2 to 8%. Pain will do that, right? But if this person says they're not in pain and we're seeing this, it's a motor control issue, which is I'd rather pick these things up before they experience pain so we can potentially fix that. So this problem in the trajectory of their foot as they're going through that contact phase, this could be fairly new and they haven't compensated for that. If I saw this pattern and then these lines looked like they did on this side over here, I can actually see that and say, okay, so this means that this person has had this for a while and they've been able to overcome that, right? And this is something that we see in, again, people like Paralympians that have these conditions that they've worked really hard to overcome, right? So they have deviations from the mean, the average of normal values, because they have a condition that has changed their biomechanical features, neuromechanical features, some feature of their pattern, but they worked really hard to become the most efficient they possibly can be, right, at whatever was given to them in terms of rectifying their problem. So I'm going to go back to the details view. And again, just to reiterate that, we can do this comparison of the data And at some points, we do see some dramatic stride differences. Keep in mind that if I don't have good efficient propulsion, that's going to influence going into the swing phase. And in fact, it's going to create a much greater reliance on my hip flexion moment than it does on my plantar flexors. And that's why I say that, you know, you're looking at this and you're thinking, well, you know, the person's not in pain, so why bother? Well, eventually it could become a problem. It's kind of like driving in your automobile with bald tires, and eventually the tire may pop, or you may slide on the ice if you live where I do. You don't get good traction, you can't go up the hill, all of those things that could occur if, right? And so I would typically change my tires before I go off the road and get into an automobile accident. So if you're working in the prevention world, then that's something to take into consideration. So I want to look at a different one here. So as I mentioned, that increasing the speed adds challenge, right? It creates an over challenge event, and we get some different data potentially from that. Now, here's some of the things that should be an expectation. If you have someone run faster by 10%, you will see dramatic changes. Less than that, the body actually has a pretty good chance of compensating for that, because if they are repetitively been running, then their neurological system helps to compensate for that, and they can make some of those changes. So we see that we've increased the speed by almost 20%, and the cadence has increased. Makes sense. They're running faster, so they're also going to have an increase in steps per minute. But here's what we start to see, and potentially some of these changes is we start to see this asymmetry increase. So if this person was wanting to improve their running pace, right? Because in running events, it's about time. And so we want to make sure that they can run faster. Well, here's the problem. When they start to run faster, it's like driving in your automobile and it starts shaking at higher speeds. One, that may not be safe, but two, it certainly is going to have a limitation in your performance, and potentially is going to increase the risk of an injury of some sort. Okay. So we do see that we start to have this increase in the asymmetry. Now, the angulation, their strike pattern doesn't change a whole lot, and that makes sense. I really wouldn't expect it to. We do see that they're running faster. And again, I want to emphasize this fact that even though they're spending more time in contact, right? Reiterate, when you run faster, you will spend more time in the air, right? So despite spending more time on the ground compared to the other leg anyway, we still have a longer stride length on that side. So that's why it's important to say, if they're spending more time on that side, is that the problem side or is it the other side, right? And that's where we need to think about that and decide where the problem actually is. And it takes a little bit of effort to accomplish that. We look at the strike, like I said, the strike pattern doesn't change, and even the strike force has not changed dramatically. Let's look again at this, and we see that we actually have a little bit more widening here. So the standard deviation in the contact phase is increasing. Well, what does that tell you? They're struggling. They're struggling with being in contact with the ground. And here's what happens when you start running faster is you're typically going to have to compensate and turn that step and stride over more quickly, obviously. But there often is going to be an increase in ground contact force. It makes sense. It's one of the ways that we run faster. In fact, if you run really, really fast, like sprinting, that's exactly how we know you're running faster, is there's an increase in peak vertical ground reaction force. It's normal. We actually train that. And so you can also see, especially on heel strike, there's a lot of widening here, even more so. Okay. They're following the same trajectory or the same pattern as we see in the slower speeds, but we're seeing an increase in that variability, right? And so even though they're trying to strike the same, they're just not as comfortable for whatever reason. Now, they're not in pain, like I said, so this has to do with a potential motor control feature. And again, you see the dramatic difference in propulsion. This person is really coming off and towing off over on the middle to the outside of that foot, and that's not considered to be normal in terms of the gait pattern, right? So then we can go to the details view, and again we can click on one of these points, and we see at this point he's at 8.2. And what's interesting is that 8.2, we see a further increase in the discrepancy. So now we're at 11% difference in ground contact time. And again, this is the side that we're not having a problem on, right? Even though a lot of people want to look at that and they will think, well, I wonder what's going on. It's not that they're spending a lot more time in ground contact time. It's that the other foot's not spending enough time in ground contact. And they're not getting the benefit of being able to generate force or power to turn that step over as quickly. Okay. Even though, and this is again a very dramatic difference, 11% greater contact time, but somehow that foot is still able to generate the same stride length. Okay. And again, why is that important? Because it tells us that this is not the problematic side. It's actually the other side that is not spending enough time in ground contact. Because likely, if you were to do a follow-up test, and I'll talk about this in a second, you would be able to further evaluate some of the symptomatology. And so what we see here, again, this propulsion angle is really lacking. And so they're spending a lot more time in that propulsion phase, as well as having that abnormal angle. Okay. So we're able to tease this out and basically show that this person, if they want to run faster, they're going to have to make some corrections. So like I said, I always start with a walking, and then I add some other things, right? Just like you would always do to further, develop your diagnosis or whatever it is that you're trying to come up with in terms of your intervention. So what I'm seeing here is there's some abnormalities, and I need to figure out, is it a weakness? Is it the inability to land appropriately and take off? And that's where I add some jumping, and that's why it's beyond today's talk, but that's why I also add some of the jumping analyses in, because then I can do a comparison of maximal effort opportunity and really compare ground contact times as well as the force and that turnaround. That's where the triple hop comes in. And what's cool about that is I can actually see the foot orientation as we're going through those maximal effort hopping techniques, which in a hopping technique is horizontal. I always do a counter movement vertical jump and a static vertical jump. So that way I can assess again and look at some of that power capability. All right. Oh, there it is. Oh, maybe. That's a cool picture, right? So I was fortunate or unfortunate enough to actually be recording someone while they were conducting a test and had an inversion ankle sprain. That'll be a topic for another day. All right. So that's our conclusion. I like to make sure that we have enough time if there are any questions. As Rana said, you can put some questions in the chat if you have any. That way it won't bog down the airways with questions, and make it a little bit easier so we can read them and take them on one by one. So if you do have any questions, feel free to write them in the chat section. And while people are doing that or not doing that, I just want to thank you for taking the time and listening. Hopefully this provided you some information, better implementation on maybe how to use the product. And again, knowing that we do this every single month, please keep on the lookout for next month's topic, which I'm still deciding. All right.
So apparently no questions so far. I've just added our education department email. So if you've got any questions, or Brandon, you're on mute. So I've added our education department email so that you can email us if you have any questions for Dr. Prue or for us, or if there's a special topic you'd like to see in a future webinar, or if you have a special analysis that you'd like us to discuss during a future webinar. So we're here for you, and we're looking forward to having you with us next month. Also, it's going to be a different case, a different topic, or a different pathology. So back to you, Chris.
Cool. Yeah, thank you. As Rana said, you know, if there's some specifics, then, you know, feel free to let us know. I try to choose a variety of things that will cover the different types of practitioners that we might be working with. So if you have any ideas, please let me know. And then, you know, feel free to reach out if you ever have any questions. You know, you don't have to wait till next month. And we don't want to wait that long if there's something that we can do to help you out.
Okay, so thank you everybody for being with us tonight, and we look forward to seeing you again. And we would like to wish you a very good evening. And good afternoon to you, Chris. Bye.
Yes, thank you. Bye-bye, guys.
Bye.